Okay, so myopia is sort of the medical word for short-sightedness or nearsightedness. So when you are myopic, what it means is that objects in the distance are blurred, but things close up to you are in focus. So for children, when they're born, their eyes are small, so normally about 16 to 18 millimeters, and like the child, the eye also grows as they get older. So usually when you're an adult, it's an average of 24 millimeters. But essentially, if your eye keeps growing, you go from being long-sighted when you're little to normal-sighted, and then you can become short-sighted. So for children who are short-sighted, they would start to notice things like the blackboard is blurred, or things in the distance aren't clear. And this can affect them in different ways. You know, it can have sort of social and emotional impact on them. They can struggle with things at school. They can struggle with doing sports. For example, if they do go swimming, they may not be able to see the clock at the end of the pool or the end of the pool. So it impacts, you know, the ability for children to see their environment around them. Okay, so myopia is caused by a combination of genetic and environmental factors. So genetics plays a big role. If you've got one parent who is myopic, you are 3 times more likely to be myopic yourself. And if you have two parents who are myopic, you're 7 times more likely to be myopic. But there's also a big environmental factors at play, and this is reflected in the fact that in the UK, for example, the amount of myopia has actually doubled in the last 50 years, and now 1 in 4 teenagers are myopic. And it's about sort of the change in our environment and the things that we do. So we spend less time outdoors, we spend more time doing near focused activities, for example, looking at screens, looking at tablets and reading. And this is all contributing to us generally becoming more myopic with time. So these risk factors are things that I've already sort of mentioned. So obviously your genetics. So if there is a family history of myopia, but now it's more common for children to be myopic with no family history, and for them to be the first one in their family to need glasses. What there is good evidence for at a population level is things like spending time outdoors. So ideally, all children from a small age would spend at least a couple of hours outdoors every day to reduce their chance of getting myopia or progressing myopia. They would spend less time on screens. Obviously, that's difficult. We know that children do need to spend time these days looking at screens, particularly in lockdown and COVID times, to learn. But obviously, if you can minimize that, if you can take regular breaks from it, if you can ensure that the screen is at least 30 centimeters away when you're looking at it, and that you have good lighting. Lighting is also very important. We know, for example, myopia does get worse in winter months when there is less lighting. So those risk factors are the things that you can kind of control yourself, apart from obviously your genetics. Yeah, so once you are myopic, we can't reverse that. When you're a child and your eye is growing, it's important that you have your eyes tested on a yearly basis to check how your glasses prescription is doing. Once you get to an adult, your eye will stop growing and your prescription will stabilize. And then at that stage, you may be able to consider solutions as alternative to glasses, such as refractive LASIK eye surgery. When you are small as a child and your eye is growing, whilst myopia can't be reversed, there are now treatments that could be done in order to stop it progressing as fast. So the standard treatment for a child who's myopic is obviously to give them glasses to enable them to see, which is really important for their sort of emotional and social development, and for them to be able to learn at school. But normal glasses doesn't slow the progression of myopia. There's obviously the other things that I've mentioned that you can do in terms of the environment. But there are now some treatment options which, whilst they don't reverse it, they will slow how quickly the myopia gets worse. And that will include things like special glasses or contact lenses, which change the way that the images are focused on the peripheral retina, or low dose atropine drops as well can be used essentially to slow down myopic progression. Children undergoing these treatments, though, need regular monitoring. They need to be assessed every 6 months, where they need a full eye exam. They need to have things like their glasses prescription measured and the axial length or length of the eye measured to see how the treatment is working for them. So when we see a small child and we measure them, it will depend very much on what they can actually see. So if they've got very mild myopia at that stage and they're not struggling to see things in their environment, then they may not necessarily need glasses immediately. But if they are starting to struggle to see, or their level of vision is reduced above what we would consider a suitable level in terms of being able to do things, or they can't see the board at school, then single focus glasses is the normal standard of care to help that for them. The treatment in terms of other glasses or contact lenses to reduce progression, that is more for those that are trying to seek treatment to reduce the myopia getting worse. And that is if we find that their measurements are getting significantly worse over a 6-month period, then we will discuss those options.